The current study that we're presenting is the effects of a token economy system on increasing rate of response for children with autism. This study was done by Brittany Bergstrom, Alessandra Messina, and Angela Schuschman. There's been a number of previous studies done examining the effects of token economies in changing a wide range of different behaviors. Zlomke is cited stating token economy is used to increase appropriate behavior and decrease disruptive behavior. Different reinforcement schedules can be used where tokens or points are given when a desired target behavior is omitted. Before doing this, tokens need to first be established as secondary reinforcers. These reinforcers can be exchanged for a primary reinforcer. A number of previous studies have indicated that token economies have been especially effective when increasing compliance in children. Prior to intervention, it is important to first determine the highest preferred item or activity. This can be done by conducting a preference assessment. There's also been previous research cited examining different interventions used in increasing response rate and fluency. The purpose of the current study was to examine effects of implementing a token system of reinforcement on frequency of behavior measured by rate of responding. These effects were analyzed by using a multiple baseline design across 3 subjects that had been diagnosed as having autism spectrum disorder. Participants included in this study were 3 children diagnosed with autism spectrum disorder in accordance with DSM-5. The children's ages ranged from 6 to 7 years old and included 1 female and 2 males. Prior to selection, all participants had currently been receiving services from the same clinic in Carbondale, Illinois, that was designed for early intervention for children with autism. At the clinic, they worked one-on-one with staff to target skills in areas of communication, cognitive, social, and behavior. Individuals were selected based on similarities in levels of skill acquisition, and all participants previously had the skill of matching identical objects existing in repertoires. Prior to participating in this study, all participants were reported as having significant deficits in communication skills and cognitive abilities relative to that of their neurotypical developing peers. For this study, the setting remained the same during all baseline and intervention phases. This included 1 table, 2 chairs, and shelves containing materials for instructional learning. The sessions took place in a designated treatment room located in the day facility where participants were receiving services. To aid in measuring the dependent variable, staff needed materials including a digital timer, video recording equipment, and data recording sheets, along with writing materials. Materials needed for the procedure included a set of 3x5 laminated cards with pictures of various objects. Each card in the set contained 1 identical match that corresponded with it. Materials needed during the intervention included tokens and a token board. These tokens could be spent at the token store in exchange for tangible items or activities. These reinforcers were predetermined during preference assessment. For this study, the dependent variable was measured as number of correct responses made independently by the participant during the 1-minute duration. For the purposes of this study, a correct response was defined as a participant independently placing 1 card on top of its correct corresponding identical match lying on the table. This behavior was measured in terms of frequency or rate of response using a percentage. To test reliability, inter-observer agreement was used. During the study, 2 observers collected data during at least 30% of all the sessions across all 3 participants. The sessions were videotaped for the purpose of the secondary observer to review. This was done to minimize the effect of there being another observer present during the participants' behavior. Inter-observer agreement was scored for the number of correct responses, then calculated on a trial-by-trial basis. This was done by dividing the number of agreements by agreements plus disagreements and converting this number to a percentage. Across participants, the mean IOA was 99% with a range of 90% to 100% for the number of correct responses, and 97% with a range of 78% to 100% for token delivery. To evaluate the effects of the independent variable, researchers chose to use a multiple baseline design across 3 participants. The independent variable was only introduced once data was judged to be visually stable for all 3 participants. Once baseline was stable, intervention phase was introduced to the first participant, while the other 2 remained in baseline. If a desired change occurred and the responding remained stable for the first participant, then the intervention could be applied to the second participant. If changes were observed in the dependent variable when and only when the independent variable was applied, this could have been the basis to infer causality. Prior to collecting baseline data, all participants had met the mastery criterion for the skill of matching identical objects using flashcards. The participants were taught matching fluency by staff through use of verbal instruction and modeling of the procedure. During baseline phases, all trials were conducted in the treatment room, and verbal instruction and prompting were used as needed. To begin, the practitioner would lay out an array of cards at random in a field size of 8 on the table in front of the participant. They then gave the verbal instruction they needed to correctly match as many as you can in 1 minute. Then would present the discriminative stimulus in form of the verbal cue match, and the timer was started for a 1-minute duration. Once a correct match was made, practitioners would quickly remove those 2 cards and place it with a new card so if the field size remained the same at all times. The number of correct responses made during the 1-minute duration were counted and recorded onto a data sheet at the end of the time. Participants continued in baseline phase until data on response rate was judged as visually stable for all 3 participants. Then the intervention was applied to the first participant while the other 2 remained in baseline phase. Prior to intervention being implemented, a token analysis was done. This was used to determine the number of correct responses needed for each individual in order to earn 1 token. Tokens were delivered on an individualized fixed ratio schedule of reinforcement. Tokens were first established as condition reinforcers through the process of pairing reinforcement with delivery of tokens, and then this was gradually faded out until participants were only receiving the tokens themselves. The other step that was needed before implementing the intervention was to conduct a preference assessment in order to determine the highest quality reinforcers for each individual. For this study, we used a multiple stimulus without replacement. This was conducted in a quiet room with no other children present. The experimenter and students sat at a desk directly across from each other. Only materials available were the chosen stimulus, a data sheet, a pencil, and 4 items, including both edible and tangible. First participant chose items to be highly preferred, including M&M's, Skittles, mini iPad, and a flashing dog toy. The second participant chose items including Oreos, Starburst, pretzels, and chips. The third participant chose items to be highly reinforcing, including the mini iPad, computer game, classical music, and M&Ms. For each participant, these orders were then ranked from highest to lowest preferred. For the intervention phase, the setting and procedure remained the same relative to baseline phase. Participants were informed that they could earn tokens by performing the predetermined requirement of correct responses or matches, and they could exchange these tokens for items chosen during the preference assessment at the token store. All variables remain the same during intervention phase as they were in baseline, with the exception of the introduction of the independent variable in form of the token economy. To ensure social validity, 2 questionnaires were presented. One questionnaire regarding treatment was given to parents and teachers. A second separate questionnaire regarding procedure was then given to teachers and observers. The results found that all parties reported that the study was both appropriate and acceptable. For this study, the effects of a token economy system to increase the rate of response proved to be effective across all 3 participants. During baseline phase, an average rate of response for participant 1 was 6 matches per minute. This increased during intervention phase to a mean number of matches being 15.375 matches per minute. For participant 2, a mean number of matches during baseline phase was 5.571. This increased during intervention phase to an average of 11.385 matches per minute. Finally, for participant 3, she averaged a mean number of 11.2 matches per minute, and this increased during intervention phase to an average of 21.4 matches per minute. This graph depicts the increase in rate of responding when the intervention was applied. It also shows that the data was shown to be visually stable before applying the intervention to each participant. The current study's results indicated that a token economy proved to be a successful intervention for increasing rate of response in regards to matching fluency across 3 participants, all diagnosed on the as having autism spectrum disorder. The primary threat to validity for this study was that researchers were unable to completely control for practice effects that may have occurred when the 2nd and 3rd participant remained in baseline, waiting for the intervention to produce stable results for the 1st participant. Another possible threat to validity was that establishing operations prior to the participant entering the clinic could not completely be controlled for by researchers. Limitations of this study include that the number of correct and incorrect responses during trials were not recorded by staff, and there was no measurement of accuracy of responses. Another limitation is that no maintenance or generalization probes were conducted after intervention phase. Future research may want to continue to examine effects of using a token economy in conjunction with other effective strategies to increase rate of responding. Future research may want to conduct maintenance and generalization of target behaviors once token economy reinforcement is no longer provided to that individual. And this concludes our presentation on the effects of a token economy in increasing rate of response. Thank you.